involves the examination of cranial nerves, reflexes, and the mental status of the client.
Assess the client mental status and level of consciousness. Note the level of consciousness. In this case, the patient is alert, awake, with eyes open, looking at the examiner. So observe posture and body movement. Observes dress, grooming, and hygiene. Observes the facial expressions. Observes the speech of the client. Observes the mood, feelings, and expressions. Observes thought process and perceptions. Test for the cognitive abilities by assessing the client's orientation to time, place, and person. Concentration, recent memory, remote memory, use of memory to learn new information, abstract reasoning, judgment, visual, perceptual, and constructional ability. So in this case, hindi na namin isa-isahin per item since these items had been discussed during your physical examination 1. All you have to do is just to review it and do it on your return demonstration. Test the client for cranial nerve number 1, olfactory, by asking the client to clear the nose and identify a scented object that you are holding. Ask the client to close the eyes. Occlude one nostril and identify a scented object.
May naamoy po ba kayo, ma'am? Meron po.
In this case, the client is able to detect various odors in each nostril. Cranial nerve number 2, the optic nerve, by using a Snellen chart. So again, we will not perform it since this was done already in your physical exam 1. You can ask the client to read a newspaper or margin paragraph to assess for the near vision and then assess the visual fields by confrontation. Assess cranial nerve number 3, the oculomotor, number 4, trochlear, and number 6, abducens. Inspect the margins of the eyelid of each eye. Assess extraocular movements. Assess pupillary responses to light and accommodation in both eyes. So again, this was also done during your physical exam 1. You can review. The test for cranial nerve number 5, the trigeminal nerve. First, by motor function, you ask the client to clench the teeth while you palpate the temporal and masseter muscles for contraction. Then assess by sensory function. Touches the forehead, the cheeks, and chin with the sharp or dull side of the paper clip. Then varies the sharp and dull stimulus in the facial areas and compares sides. In this case, the patient reported that she can feel the object touching on her face. Then test for corneal reflex by asking the client to look away and up while you lightly touch the cornea with a fine wisp of cotton. We will not be doing it in this presentation, but you can see it in our lecture presentation. As for cranial nerve number 7, facial nerve. By motor function, ask the client to smile. Frown. Wrinkle at forehead. Show teeth. Puff out cheeks. Purse lips. Raise eyebrows. Close eyes tightly against system. Okay, so by sensory function, touch the anterior 2/3 of the tongue with a moistened tongue applicator. Dip in salt. Of course, when you do this, the patient should not know that you are getting the salt because you are testing if the client is able to identify.
Ano po nasa? Pangalan.
Okay, and then sugar. And then lemon juice, but in this case we won't have lemon juice, we'll be using vinegar. Then ask the client to identify the taste. So in this case, the client was able to identify the taste of the sugar, the salt, and the vinegar. Test for cranial nerve number 8, acoustic and vestibulocochlear. First, test the client's hearing ability in each ear by whispering words from 1 to 2 feet. Then performs Weber's test, performs Rene's test. So the 3 tests mentioned had been discussed during your physical exam 1. So let us now proceed to another test. Performs heel to toe walking. So as the client walked, the client was able to maintain the balance with tandem while walking. Perform Stromberg's test. Let the patient stand with her feet together and the arms resting at the side. First with eyes open, then eyes closed for 20 seconds. And then you assess the client for balance. By motor function, you ask the client to open the mouth wide and say "ah" while using a tongue depressor. You have to observe if the uvula is located in the midline, and again, this was done during your physical exam 1. Make sure to know his voice quality or her voice quality. There should be no hoarseness, and the client should speak with a soft voice. And then test for gag reflex. So there is a presence of gag reflex. And then assess the client's ability to swallow by asking the client to drink water. Okay, ask the client to drink the water, and then shoulder. So there should be no drooping of the shoulder. So it should have symmetry, strong contractions of the trapezius muscle, and strong contraction of sternocleidomastoid muscle on side opposite and turn the face. Findings for the tongue movements. So the client should be able to move the tongue symmetrically and should have smooth and bilateral strength is apparent. To assessing the deep tendon reflexes. Test the biceps reflex by asking the client to partially bend the arm at elbow with palm up, then place your thumb over the biceps tendon and strike your thumb with the reflex cover. Repeat on the other side. The normal result is that the elbow flexes and contraction of the biceps muscle is seen or felt ranges from 1 class to 3 class. Then test for brachioradialis reflex by asking the client to flex the elbow with palm down and head resting on the abdomen or lap. Then tap the tendon at the radius about 2 inches above the wrist. Repeat on the other side. The normal result is that the forearm flexes and supinates. Ranges from 1 class to 3 class. Test triceps reflex by asking the client to hang his or her arm freely while you support it with your non-dominant hand. Then with the elbow flexed, tap the tendon above the olecranon process. Repeat on the other side. The normal finding is that the elbow extends. The triceps contracts and extends. Ranges from 1 plus to 3 plus. Then let us now proceed to test the patellar reflex by asking the client to let the both legs hang freely off the side of the examination table. Then tap the patellar tendon, which is located just below the patella. Repeat on the other side. The normal result is that the knee extends, quadriceps muscles contracts. Ranges from 1 class to 3 class. Now proceed to test the Achilles reflex. When the client's leg hangs freely, dorsiflex the foot that tap the Achilles tendon with a reflex cover. Repeat on the other side. The normal result is that the plantar flexion of the foot ranges from 1 class to 3 class. And that ends our physical